and I'll be moderating today's panel, which is being presented by AVAC, a biomedical HIV prevention advocacy organization based out of New York. So during the hour, we really hope to be able to broach some of the myths and misconceptions around PrEP, and also hopefully offer some new insights around this intervention. And as we begin to deliver community strategies to increase PrEP uptake and rollout, these sort of conversations are essential, and your voices are essential. So I really encourage you all to raise your hands and offer your commentary and your opinions. If you have any questions for the panel, please pose those questions as well. So without further ado, I'd like the panelists to introduce themselves and any organization, and you can answer this question during the introduction. Why PrEP? Why now?
Good morning, everyone. My name is Leo Moore. I'm an internal medicine physician at Yale University School of Medicine. Transitioning to UCLA for health policy and community research fellowship. Why PrEP? Why now? I think the way that I would answer that question is that we know that PrEP works. We have the data that shows that it works, and this is the time to take advantage of it for everyone who can benefit.
Good morning, everyone. My name is Jonathan Lucas. I am employed by FHI 360. I provide support to 3 different HIV networks, the Microbicides Trials Network, the HIV Prevention Trials Network, and then IMPACT, which is a mother-to-child prevention of transmission network, the treatment network. Why PrEP, why now? We know that there are increasing rates of HIV among Black men, particularly younger Black men. I think PrEP is another tool in our HIV prevention toolbox that we can offer people to mitigate their risk and lower these rates of HIV infection.
Good morning, everyone. My name is Noel Gordon. I work at the Human Rights Campaign in Washington, D.C., where I work on 3 main issue areas: HIV/AIDS, racial justice, and transgender equality. Why PrEP? Why now? I think, as someone who believes very strongly in people's right to lead happy, healthy, and productive sexual lives, that PrEP is another effective tool in the toolbox to allow them to do just that.
Good morning. My name is Deshaun Usher. I am the Community Education and Recruitment Manager at the New York Blood Center's Project Achieve, located in New York City. There we do HIV vaccine research trials along with other biomedical intervention trials and other behavioral intervention research studies. So why PrEP, why now? I think more so it's about allowing people options and giving them the tools that they need to make whatever choices they want to make as it relates to their best sex practices.
So PrEP is a relatively new biomedical intervention. It was just approved 2 years ago, just received its FDA approval 2 years ago. In your opinion, how has the flavor of the conversation around PrEP evolved since its approval?
Yeah.
So I think when PrEP was first introduced, there was apprehension from various stakeholders. There was joy that there was this other option available. Then there was also apprehension related to how this would be rolled out, what this would mean for the community, particularly those individuals who were HIV positive, and Truvada, the drug that's approved for PrEP, is one of those frontline drugs. The concern was for community resistance. And I think that, with the new CDC guidelines that gives you clear direction on how PrEP should be administered, I think that has lowered some of that community concern. When you go into get a prescription for PrEP, you have to be tested each time you go to make sure that you are still negative before you get that prescription. And I think that's
to put what was just said in sort of a personal frame, I've noticed that awareness around PrEP has increased in my own social circles, and I think that's been the result of advocates, direct service providers, physicians, nurses, taking on PrEP as an issue that they want to promote to their clients or to the people they interact with as, just as you said, an effective tool and allows them the opportunity to, like I said, lead productive, happy, and healthy sex lives. And so, in my circles at least, I think the flavor of the conversation has changed, where there was apprehension, like Jonathan said, and I think a lot of wonder and awe around PrEP to the point where I've seen people in my own circle, social circles start to ask each other, are you on PrEP? What do you think of PrEP? Do you know anyone on PrEP? So I think we've shifted away from PrEP being sort of confounding or confusing, and now people are interested and intrigued. And I think that's only going to lead to better and more positive results as we move forward.
So I have slightly a different take. For me, I think it's been 2 years too late. In the sense of, like, the research has been built in, like, before it was even FDA approved. So we knew some of the results that PrEP worked and that it was effective. But yet there was still apprehension within the community, especially among CBOs and doctors and providers with their hesitant views on, like, trying to prescribe a pill to somebody who's perfectly, quote unquote, healthy, that didn't necessarily need this tool. And so it has been those limitations that still 2 years later, which is still going on as far as, like, some of the barriers when it comes to PrEP, as far as educating communities about it, allowing your clients their options about the information that relates to this drug that can potentially prevent HIV within their lives. And so I think that it definitely has been an improvement over the past 2 years, but if anything, I feel as if, like, we're just now beginning to touch the surface of, like, what this pill actually means.
So, I agree with Deshaun. I think, on a personal note, one really important thing as a medical provider that I see is there just aren't enough medical providers even doing a sexual history. So if they're not even comfortable doing a sexual history, then how are they really going to talk to you about and assess your interest or even your need or desire for PrEP? I mean, when I relocated to New Haven, Connecticut, I went to see a physician there, and he skipped right over the sexual history completely. He didn't ask me, any questions about if I wanted to be tested, if I had been tested, anything like that. So I think, one of the first places that we have to start is in educating those providers to be a little bit more comfortable broaching the topic of sexual history, and then also talking about PrEP. And I think with the CDC guidelines, maybe over the next year or so, we'll see more doctors realize that, look, this isn't going anywhere, so I need to do the work and know about it. And I think one of the things that people in the audience can do, which pushes those medical providers, is to ask them about PrEP. Because when you ask about it, then they realize they have to do the research, because people are going to ask about it. So I don't want to look as if I don't know, so then I need to be up on the data. One thing that I did on my time coming down was check one of the main resources that a lot of physicians use. It's called Up to Date, to see what type of data they had there, about PrEP and the research that they have laid out. And they have a really good article there, so that way physicians can feel that they can get a brief and quick update on what's going on with PrEP, and then they have information there about the side effects and monitoring and all those different things that are important. So in order to empower the physicians, and the medical providers, get out there and ask about it as well.
There is a question. I'm not a medical provider, certainly not as educated as should be on PrEP. You have someone who's failed a Truvada, but someone is taking Truvada for PrEP, and do they they still, they have a likelihood of transmitting because they have a resistant strain of HIV for that drug, or is that not applicable? Oh,
I just want to clarify the question. Okay, so are we saying first that we have an HIV positive partner and an HIV negative partner? Okay, and the HIV positive partner, we're saying they're resistant to Truvada. Okay, and so what I would say is that there is a risk that if they're having sex with that person, that they may get a resistant strain. There is that risk. One of the things that we know about the data as well is that we've seen that the resistance, when there is HIV resistance to Truvada, a lot of it is that the patient was already infected with HIV before they started the Truvada. So, one of our goals is to make sure the person is not already positive, which may mean multiple HIV tests before starting on PrEP.
And I was just going to add that also, so if the partner is positive and they did fail Truvada, then they should be on another regimen that would ultimately decrease their viral load and the chances of them passing it on to their partner. And so if they're on another drug regimen and the HIV uninfected partner is on PrEP, they would still have some protective factor in it.
So as we kind of understand what we do and are asking our clients to utilize PrEP, what type of message are you suggesting them to utilize our clients and they say, well, if I engage in PrEP, why should I continue to use other methods that I constantly
I think the most important message is that PrEP only protects you against HIV. It doesn't protect you against syphilis, chlamydia, gonorrhea, HPV. So you have to take all those things into account. One thing that's very important, as I'm sure all of you know, when you are speaking with your clients, you have to give them all the information so that they can make an informed decision.
And one thing that I would add is that, PrEP is not 100%, so having that conversation that the more tools that they use, the more they decrease their risk, so just to kind of add
But then I would also let you know that we do have clients that aren't going to use condoms regardless. And so if they're not going to use condoms regardless, no matter how many times you may give them a condom, this is an option for them to have protected sex. PrEP is a protective factor as it relates to sex. And so having this pill, they're still having some form of protected sex. In the sense of, if they're not worried about, any of other STDs other than HIV, then the pill can, possibly be the option for them if they do not want to engage in sex with a condom.
So Jonathan, you alluded to this earlier. We could discuss in community. All right. This is the last question I have. No, go ahead.
I just wanted someone to talk about challenges to access.
Yeah, I was just going to ask that. Yeah, so and let's try to translate the research in full if we can. Can we talk a little bit about the side effects, access to insurance, medication, and what the research actually says about PrEP? Which one?
So this is a loaded question. So the research, what does it say? It says PrEP works if you take the pill. So you have to take the pill in order for it to actually work. It takes a while for the drug to actually build up some type of protective factor within your body. So it's not like you get prescribed PrEP and then the next day, you're protected against HIV. So it takes a while for it to build up. If you do take the pill every day, it can decrease your chances of contracting HIV by up to 90-something%. As far as access, how people go about getting it, you have to be connected to a medical provider, which can be a barrier in itself for a lot of people and a lot of your clients. And so you do have to see a doctor. You do have to get HIV tested. You still have to get your baseline kidney level function when you're doing it, so that they can make sure that while you're on this drug, that there isn't anything or any like major side effects that are happening. As far as cost, it varies, and so it's like some states have Medicaid, like where it covers PrEP. Other states have, well, most insurance companies will cover PrEP. It's not necessarily something that you can go to Duane Reade or Walgreens and get over the counter. You'll have to, talk to your insurance provider and then get the mail-in order. But depending on the actual out-of-pocket cost, depends on whatever your insurance provider is. If you don't have insurance, Gilead does have a program, which is the maker of Truvada, that does have a drug assistance program for people that are interested in it. Still, you still have to be connected to a provider. You still need a prescription for it in order for it. I think that answered most of the questions there. Another question? Adherence. So adherence is important in the sense of you have to adhere to the medication in order for it to work. If you're going on and off the medication, it can increase your chances of possibly contracting HIV within the time that you're not necessarily adhering to the medication. So if you're taking it every other day or something, the chances of it being a protective factor decreases from 90 to, it just decreases over the course of time.
So there are a couple of PrEP demonstration projects that are currently happening that are actually looking at adherence to see if there are certain things put into place, does that increase adherence? Because we know if you take the pill, as Sean said, it provides, if you take it as prescribed, I'm sure I said if you take it as prescribed, it offers you protection of upwards of the upper 90s. The HPT and the HIV Prevention Trials Network is actually doing a PrEP demonstration project for Black men who have sex with men. They're enrolling 225 Black men at 3 sites, one in Chapel Hill, another in Washington, D.C., and one in Los Angeles, California. That's actually implementing something called client-centered care coordination, where it's addressing a lot of the structural issues that Dr. Mitchell Wharton spoke about on Thursday. So it's looking at the lives of Black gay men holistically and not just at their PrEP taking behaviors, and how we can support those PrEP taking behaviors.
I want to add a little bit about the side effect profile and monitoring and things like that. So we do know that in some of the studies they saw that patients had some renal injury. So we check their creatinine, which is a number that assesses kidney function. They also said that there were patients who had issues with the liver as well. So we do check LFTs or liver function tests as well. And patients who have chronic hepatitis B, they're having flares of hepatitis B that have been shown in patients who take Truvada. So recommending hepatitis B screening and things like that as well. And then the last thing that was of interest is that some patients had signs of, I don't want to say that they were on the route to developing osteoporosis, but that when they looked at their bone density in comparison to other patients, they saw that their scores were a little bit lower. So just kind of something as well to think about. There is not finalized data on that, and of course, over time we'll get more information. But those are some of the key things.
I'm going to put Noel on the spot, because Noel is a very vocal PrEP user. I was wondering if you could just talk a little bit about your experience. How was it accessing PrEP? What's the appearance like? If you experienced any side effects, you can talk a little bit.
Well, I'll preface this by saying that I'm certainly not, I'll put it in the affirmative sense. I'm very privileged in the sense that I connect care through my employer. I live in Washington, D.C., which has a high rate of HIV transmission and incidence, but also, as a result, I have many HIV care providers and specialists. And so I'm in an area where I have a lot of protective factors. I have a lot of things working in my favor, where I think where the epidemic is concentrated and its hardest, that's not the rule, and I'm the exception to the rule. So I just want to preface by saying I hope no one would abstract my experience too much, but I will talk about my experience with PrEP, which has been fairly positive. I first talked about it with my physician, who is an HIV specialist, as we were doing my wellness check, my annual visit. And he spoke to me very candidly in the same way that we've discussed here, laid out all the side effects. And I think two things really allowed me to make that sort of next step. One sort of political or philosophical, and the second very practical. The sort of political or philosophical point is in a world where we don't give people access to comprehensive sex education, a lot of people have trouble negotiating condoms, negotiating how to give consent or receive consent, how to feel comfortable turning down sexual advances. I've spoken to a lot of my friends who are gay men who tell me the number of times they have had sex with people they actually didn't want to have sex with because they didn't know how to say no. And I think research tells us, and my experience confirmed based on what I've heard from friends, that because many young black men who have sex with men have sex with older men who have sex with men. And so there can be a power dynamic in those relationships where it's harder to say no to someone who's older than you or maybe more masculine than you do. And so in that way, I think PrEP was great because it sort of, like Sean says, gives a protective barrier that you don't have to negotiate with another person. Your decision to take PrEP is you taking a step to sort of be an advocate for yourself, and to protect yourself, and put yourself in a position where you don't have to negotiate with someone where you feel uncomfortable or unsafe. And so for me, that was very appealing to know that I had that factor in cases where I may feel uncomfortable negotiating condoms or sex with a partner. The more practical reason is that even though I do have a lot of things working in my favor, I also am a young black man who has sex with men. I do live in a city with high rates of HIV transmission. I'm not in a monogamous exclusive relationship, and so I sort of fit the guidelines of someone who the CDC says you should look into PrEP. And so based on those practical points that the CDC laid out, and sort of political point I made about, our society is not doing all that it needs to do by young black gay men, that led me to my decision, which was to take PrEP. And very briefly, my insurance provider gave it to me at substantially subsidized cost. So it's not a financial burden for me, and I've had very low experience with side effects. And I think part of that is because my body tolerates drugs very well. Whenever I take antibiotics or things, I don't generally have side effects. And so for me, it's been an overwhelmingly positive decision and the right decision.
So I've heard a lot of things about PrEP, and as a medical provider, I'm not certain that we're hitting the mark where we should. And so I was wondering if you could speak on a couple of things. I heard a lot of discussion about health literacy and understanding exactly what PrEP is, understanding how to get it, how to get access to it. I've heard a lot of talk about what needs to happen once a person goes on a PrEP, so that continuous engagement with some sort of healthcare provider to make sure that a person is generally healthy enough to maintain the drug and be effective. I also heard you talk about health profiles of people in terms of geographic areas, so just as you mentioned about being privileged to live in an area where there is unfortunately a high concentration of HIV, but there's also a high concentration of providers that specialize in that. All of this sounds great and wonderful. However, how do we continually engage people so that they are willing enough to take ownership of their health, engaged enough to stay engaged with a medical provider, on top of all of the other health concerns, all the other health disparities that we've spoken about for this past 2 or 3 days? How do we do that and not overwhelm people is saying, oh yeah, this is another option. Because when I hear option, I hear option. I don't have to do this. I hear this is something else, and I hear this is another thing that the medical establishment has out. And I'm saying this as a medical provider, so I'm sure that people who are out there are feeling even 10 times more the magnitude of, oh, I got to do this, I got to do that, I got to do this, I got to do that. And I'm still dealing with poverty, and I'm still dealing with relationships, and I'm still dealing with other things. How do we translate all that science into something that's practical and applicable so that we are making an impact for the people who want it, the people who
So when I first started hearing about PrEP, I attended, I believe it was Creating Change, which is one of the largest conferences for LGBT advocates. I was in Dallas, Texas, and I think either Gilead Sciences was there, or the National Minority AIDS Council was there, doing a joint workshop. And one of the ways that they framed the conversation that really broke down PrEP research for me as a consumer, a potential consumer at the time, was the framing that I think I've seen other organizations start to pick up around sort of seasons of risk. And so the way I sort of use that frame to explain it to my friends is that, sort of jokingly, a colleague and I were talking that, you know, as a young black gay man, I sort of enter seasons of risk, right? And where my risk is going to be higher because I'm single, because I live in a city with a high concentration of HIV transmission and incidence, because I, enjoy having sex. And so my season of risk is, putting me in a position where PrEP makes sense for this period of time. But that's not to say that I won't meet the man of my dreams a year from now, and I won't be in the same season because my circumstances will have changed. And at that time, it may be time for me to have a conversation with my provider about coming off of PrEP and taking other tools in the toolbox, or lessening my reliance on one tool and sort of shifting to another. And so I think that framing has really translated the research for a lot of people who are new to PrEP, because it sort of emphasizes that while you're in that season of risk, it's really important for you to take PrEP as prescribed if you want the full protective advantages of it. But that's not to say that you have to be on it forever, and I think that's where a lot of the apprehension comes from. People talk about PrEP as if it's a pill we're going to give people and they're going to be on it for 99 years, right? And I don't think that's how it's meant to be prescribed to people. I think it's meant to be prescribed in terms of these cycles, recognizing that people come in and out of sexual experiences all the time, and we should be adapting to people based on their circumstances, not like a profile. So not because you hold the status of being a young black gay man that you should be on this pill forever, but more so, your situation warrants that you should be on it maybe, and your situation may change, and let's recognize that and let's have an honest conversation about that. So I'm not sure if that begins to address your question, but that framing I found made it really easily relatable for consumers, i.e. my other friends who are not as health-literate as I am, but in virtue of wanting to be on PrEP, they've become more health-literate.
And I also just want to say that I think the greatest thing about PrEP that it definitely offers is that this is the first time that we have an intervention that introduces us into the healthcare system. And so, like previously before, like we're always going to a clinic or somewhere post, just to get our test results. And that's it. You check out. You don't come back for another couple of months. For some people, it's every month. And so it's just like your options of actually being introduced to a provider, to start having that conversation with the doctor, to actually start taking care of yourself. And so it's like your visit to a doctor, for some people, like this will be their first visit to a doctor. And this may start the trend of them consistently going to the doctor and taking care of themselves and having this ongoing relationship with the doctor. And so I think like that's the greatest thing, that it at least opens up that door in it. As far as like the future of PrEP, it's not always going to be one pill once a day, like Jonathan sort of kind of hinted to that. Like they are looking at intermittent PrEP. So like PrEP like before and after sex, PrEP inside of microbicides. We're looking at injectable PrEP. And so like PrEP, like where you don't have, where almost similar to birth control, like you'll just have like a plethora of options in the future as it relates to PrEP. And so, if anything, it's about like knowing what your options are, allowing people that time to get acclimated. I think for the most part, we're not used to going to the doctors, and we're not used to seeing a physician and asking these questions, and we always feel as if it's a burden. But at the end of the day, we still have to be accountable for the things that we want to see.
I think we also need to think about when we approach someone about PrEP, particularly medical providers. If I'm coming in because I have, fungus on my toenails, I don't want to hear about PrEP. But if I came in 3 weeks ago and I had an HIV test and, I've been praying and fasting and, putting my face on the floor to make, and I come in and you tell me that I'm HIV negative, and you get that, oh, that would be, for me, the time when you say, you look a little concerned about, acquisition of HIV. Have you thought about PrEP? Because then I'm going to be right there with you. So I think packaging those messages and when we deliver them is important.
I think I would say, as a medical provider, I would really like to see more providers talking about it a lot earlier, to be honest. Talking about it before the patient feels like they're at the place where they might have acquired HIV. And even if, that means when we're first assessing sexual risk, just having a conversation, that's the moment that we say, well, these are some of the things that I want you to just start thinking about. I want you to start thinking about PrEP. I want you to start thinking about even just how often you're having sex, the way you're having sex, and also to talk about the healthy aspects of sex, because I feel like sometimes we spend so much time talking about sexual risk that we forget to tell people that they need to be actually enjoying their sex lives, and so being able to kind of balance both of those. So I think just kind of that's where I would start. And then also assessing, is this a priority for them? I agree with you in that. Is decreasing their sexual risk actually a priority? Even if it's not condoms, would they be interested in starting PrEP? And I think that you can start to have that conversation during the first visit and continue that conversation along. And I always try to leave my patients with material that they can take and read, or a website that they can go to, so that way they feel empowered, about their own care, so that way they're making the best decision for themselves because they've done the research, they talk to their friends about it, maybe they know someone who's on PrEP, or and they can come back to me with an informed decision that they're making and with questions that I can better answer.
So we're at the tail end of the panel discussion. Are there any more questions or comments or commentary? Anybody? So the CDC just released their PrEP guidelines a few weeks ago. The PrEP guidelines are really a blueprint of best practices for providers interested in prescribing PrEP. So I was wondering, why are the CDC PrEP guidelines important prescription of PrEP, and what can we as community advocates do better to help foster provider education and awareness?
I think the first thing that all of us in the room need to do are read those guidelines and become familiar with them ourselves. And then we actually have to, educate those providers who don't have that education. As Dr. Moore said earlier, when you go to your doctor, say, what do you know about PrEP? Or did you know the CDC released these new guidelines? We have to take charge of our own health. I'm a proponent of that. When I go into the doctor, I know exactly what it is I want, and I'm going to ask for it. Now, my doctor may persuade me to do something else, but when I go in there, I've got set in my mind, this is exactly what I want, and I am paying for this service, and I'm going to get the best service that my money can buy, and my money's good.
I was going to co-sign with I think just as community advocates, really, because I think Deshaun made a really insightful point when he said a lot of people in my community are not used to engaging a doctor when they're not in crisis. And so because they're always crisis managing, they don't know how to proactively cultivate a relationship with a provider. And so as advocates, I think it's important to instill in people that spirit that you are providing, or the doctors are providing a service to you. And just as you would go into a store and you get poor service and demand to speak to somebody's manager, when you go to a doctor and you get poor service, in the sense that if your provider is not educated about PrEP and if it's something that you want, I think there are ways that you can make sure that you get what you want, either by taking your money elsewhere or demanding that as a patient, I feel that you should be more abreast of this situation. So I think as community advocates, it really would be helpful to start teaching people how to develop a proactive relationship with their provider, because at least in my experience, because we're always crisis managing, and that's something that is the second or third place in our minds.
So one of the things that I'd love to see is aid service organizations, community-based organizations, and medical practices kind of working together. So I think this is an amazing opportunity for, say, a CBO or an ASO to have a continuing medical education or something like that, to get physicians in and to get other medical providers there. If it's hosted by Gilead or by another group, to kind of get those providers knowing this is something that the men that we see in our aid service organizations and our community-based organizations need. So we need you to be up to date on that information. So I think the sense of urgency would be right there in the faces of those medical providers in the community that's working right next to those different aid service and community-based organizations, to see that the patients and the clients, they need this. So we need to be up to date.
I think we're talking about, make sure you're talking to your medical providers. I think it's an assumption that that person has a medical provider. So is there a directory that's out there or some type of comprehensive list that I can go online and say, hey, here's this IV doctor in this city, or here's a black doctor that I can go to without this problem? Like, does that include?
Service provider.
In this instance, we have our health or Ryan White. So we do have directory providers that are available to Ryan White, but you're asking other providers throughout the country?
Yeah, we're talking about maybe throughout the country where you may move. And it's like, oh, well, where's the doctor in this city that's a black doctor? So it's just like an IV doctor.
So I don't know about provider specific, but the Human Rights Campaign, we actually have a resource called the Healthcare Quality Index, where we rank healthcare facilities, or we assess healthcare facilities across the country, actually in all 50 states, based on their LGBT cultural competence. And in order to meet our sort of benchmarks, part of what they have to go through are intensive trainings around how to provide culturally competent care to their LGBT patients, sort of instill non-discrimination practices for their LGBT employees. And so while that won't give you sort of the name of a person, it will at least give you some facilities in your area that you can start with. And so it narrows down the universe. So I would say check out ahrt.org/HEI.
Sean? Good morning. I'm Sean Burton with Community Sciences. And one of the things that we're able to do as community liaison and my colleagues and advisors, we are able to actually work with our community medical scientists, actually do provider education around PrEP. And for those of you who don't know, we're the company that makes provider, which is so it's something that's at no cost. We actually come in, we do all that usually breakfast programs, lunch programs, dinner programs. And it really ensures that providers are getting the appropriate level of education so that they can actually be an expert and prescribe PrEP. So if you are interested in having any of us work with you around coming into the providers, just myself. We're not the liaison for your area. We can actually work with you.
Which would be a great reason to go to the booth in the resource section.
So I just wanted to add that there's also a provider directory on the Gay and Lesbian Medical Association website as well that has a list of physicians and other medical providers who might be able to serve as well. I wish that I could say that there was a comprehensive list of specifically Black medical providers. There is not one, you know, and I would dare to say that it's something that I would love to see, but there is not one currently.
Wait, is it Dr. Warren?
Oh, just a really quick about that. Sorry, I don't mean to jump in. But just make sure that when we're talking about medical providers, we're talking about the full scope of medical providers. And so I think sometimes you get into the habit of using a doctor or physician as the primary. There's also nurse practitioners, physician assistants as well. There's an Association of Nurses in AIDS Care, which has a website as well, and you can find qualified board-certified AIDS care specialists. Sure, it's the Association of Nurses in AIDS Care, or ANAC, A-N-A-C. I think it's anacnet.org. But that's another valuable resource that's out there. There are local chapters throughout the country. And if you need more information, just talk to us.
Can you just repeat the website, Dr. Warren?
I will look it up and then.
Sorry, exactly.
I don't want to give you the wrong address, that's why.
The link in the guy.
I was just going to say what Leo said about me, what Dr. Moore said about the resource, but also the Black gay resources. Outright.
I think I had a question. I know we sit and talk about CDC guidelines. Is there like an agency or higher authority, something to like enforce this? So I know the CDC recommended everyone between 13 and 64 get tested at least one time a year a couple of years ago, and we're just now getting to the point where that's like happening. So I'm wondering, like, is there something higher to like really push these things?
Long answer short, no. But just like the CDC guidance around HIV testing between everybody between the ages of 13 to 65, it's just one of those things of where it's to set up a norm so that it eventually will become the norm. And so I think more so what's important about these guidelines and the guidance for the PrEP recommendations is that now providers at least have a resource and not necessarily an excuse as to why, they're still sort of kind of on the fence of, the research is still too early or it's still too early to tell. These are a set of principles that will at least let you know, like, who should be recommended, like what the expectations are, like how you should go about prescribing this particular medication. So I just feel as if, like, if anything, like as time goes on, it'll definitely become the norm, just like the whole like testing guidelines for everyone.
Okay, so I think, one of the good things about these recommendations is that they do empower us to make changes within clinics and within medical offices, because one of the barriers to even getting more people tested in one of the clinics I work in has been that the medical assistants don't feel comfortable asking a patient when they come in, do you want to be tested for HIV? So in order to be able to say, these are the CDC guidelines, this is what we're going to do, so we can do some training around that, but at the end of the day, this will be a part of your job description. That's kind of one of the ways that the CDC guidelines help us, or in emergency departments where we want, the nurses or we want the medical providers to be asking these questions, and we can use those guidelines to say these are the reasons that we want those questions asked. So I think because of a lot of the sexual taboo and things that we deal with in our country, there's more that we need to do around having people get more comfortable having these conversations about sex, and I think that will kind of help push these guidelines and push these recommendations to actually meet the goals that are set.
Okay. So we have one goal to the question. The question is, which provider can prescribe PrEP? Does it have to be an ID medical doctor, or can an internal medicine medical doctor also prescribe PrEP?
So internists can definitely prescribe PrEP. For sure, internists can. And also, nurse practitioners can also prescribe PrEP as well. So it's really important to know that it doesn't have to be an internist. It just has to be a person who has privileges to prescribe medication. So that's really important. And so with that, there are a lot of providers that you can go to get PrEP and to be monitored and build that relationship that's important.
All right, one last question.
Yes. Well, what you talked about testing. Universal testing, where we will just make it just regular routine. Where are we at here in the United States? Just like you just have any other test. Where are we? Testing is
Are you asking in regards to HIV testing? So where are we at in
that we would just, because I think what needs to happen, it needs to come out of the law. Just like when you go and you have just your other labs, you just have a HIV, I mean, it would be included in your, you understand this? Yeah.
Yes. So with the CDC guidelines and recommendations is that everybody do get tested. I know inside of a lot of emergency departments and hospitals, it's part of your routine. Like once you're in there, unless you opt out of HIV testing, then your screening usually it includes HIV testing. And so I think we're definitely a lot closer in the sense of that becoming the norm in most cities and states. So that is currently happening.
So we are at the end. We're actually over time. But I want to thank you all for coming out to this morning's breakfast panel. I encourage you all to visit avac.org/PrEP if you want to learn more about PrEP. And I want to thank the Right Door Foundation and Saving Ourselves Symposium for convening this panel. To learn more about the Red Door Foundation, please visit trd@memphis.com. Thank you. We don't need